Hey everybody, and welcome back to Bottomless Coffee with Jerome. On this show, we have great conversations with incredible people who are working to bring us together instead of divide us further apart. And we do that over coffee or tea or water. Honestly, as long as the conversation is good, our guests can drink whatever they want. And we'll turn to our guests today in about 30 seconds. But first, I gotta tell you, I might be done with flying. I went to visit some friends for a bachelor party, and on the way back, the guy next to me, seat 16A, lowers his mask and sneezes. So, yes, I literally felt the sneeze juice on my face, and you guessed it, I got COVID-19. So, like you do, I went to Facebook to tell people that, first Fauci, then Biden, and now finally, Jerome Evans of Bottomless Coffee have all contracted COVID. And just as I was about to hit post, I noticed that everyone was talking about monkeypox instead of COVID-19. And that's where our guest comes in. Mattie Laidlaw, she, her, hers, is a community engagement systems planner and community liaison co-lead for the LGBTQ plus cultural, faith, and disability communities branch for the Minnesota Department of Health. Hey, Mattie, how's it going?
Good.
Yeah, you've got a really fun, kind of lengthy title. Can you tell us a little bit more about what you do?
Yeah, so for the community engagement systems planner work, it's a combination of trying to develop the skills of Minnesota Department of Health staff to do a better job at engaging with community authentically and centering community-driven solutions for things. Oh. And then the other piece of that role is to actually do direct engagement just like this. And because I'm a part of the LGBTQ community, that's my primary focus for my outreach.
Very cool.
And then the liaison work was something that came out of the COVID-19 response. And so a lot of that has been focused on getting information and resources out to the LGBTQ community, elevating concerns that I'm hearing from community members, and then advocating for resources and systems changes to better serve our community.
I was just about to ask you about that because we first met maybe a couple of months ago over I think Microsoft Teams. And we were only really talking about COVID-19 at that time. And I was actually able to draw from a lot of that conversation while I was still testing positive day after day after day. But now you're here to talk about monkeypox, which to me says, okay, Mattie's job can encompass a whole lot of things, a whole lot of apparently infectious diseases.
Yeah, unfortunately, that's what's happening in our communities right now. So.
Yeah, well, what is monkeypox?
So monkeypox is a rare viral infection, and it's something that first was found in humans in 1970, but really didn't show up in places like the United States until May of 2020 this year. Or sorry, 2022.
Oh, yes. Time is weird now.
Yeah, I know. The pandemic has made it so that everything's 2020 still. So it's something that wasn't really seen in the U.S. before then, and because of that, it's kind of something that we're keeping an eye on, and we have in Minnesota now, and so it's really important that we get the message out about monkeypox and make sure that we're supporting community and protecting itself.
So as a community liaison, you kind of let people like me know what's going on in the state with regard to monkeypox.
Yep.
And then typically I would distribute that information out. But this time we're lucky enough to have you in the flesh, in person, letting us know what's going on. So before May of 2022, were you even studying monkeypox? You know what I mean?
Nope, not at all. Yep, I was not on my radar, had never heard of the virus before.
Yeah.
It was something that, like I said, it's been around since the 70s in humans, but it was really concentrated in African countries. And so we didn't see it spreading to other countries until this year. And so because it's disproportionately impacting some communities, then we're getting pulled in to really make sure we're supporting people and taking care of themselves.
So, what are the symptoms?
Yeah, so the main one that we're helping people keep an eye out for is a rash. And so rashes can look so many different things, but the one that we're seeing right now for monkeypox, it's pretty different than what, like if you were to search monkeypox on Google, the images are more related to earlier outbreaks and really not what we're seeing.
Oh, okay.
Yeah, so if you, there's some more that are coming out now that are a better depiction of this current outbreak, but it really it looks like a pimple or a blister.
Yeah.
And you might only have one. You might have just a cluster of them in a certain part of your body. So it can be pretty much anywhere. It can be in your mouth, on your hands, on other parts of your body, your genital area, your anus. Those are all specific parts that we're starting to see more commonly with this outbreak.
So I'm hearing that the Google image search for monkeypox was probably going to give you like images from the old outbreak.
Yeah, mostly. And it'll look a lot more severe than what we're seeing. So it'll look a lot more widespread and like what we think about when we think about a rash. Whereas this, it's really very small pimple or blister-like bumps that we're seeing.
Okay.
And like I said, there's been some folks that they've only had one. But if they're getting into skin-to-skin contact with other people, they can still transmit it.
And that does get into transmission. I do want to check though, since sometimes it's just a little pimple, does it still hurt?
There can be pain associated with the area. Some other symptoms folks might get are kind of flu-like symptoms.
Oh, okay.
So fatigue, swollen lymph nodes, a fever, things like that to look out for. But it's not until someone has the bumps that they're actually contagious.
See, this is really good information because the fever and what have you could also be an indicator of COVID, right?
Yeah.
And so,
right.
It's the bumps that we really want to be on the lookout for.
Yep. And I mean, if you're
yeah.
sick, you probably should be limiting your contact with other people anyways.
That's true. I am proud to say that when I got COVID, I shielded my husband from me.
Yeah.
I was like, no, we're in a privileged position. We are going to end this particular line with me right here.
Yep.
So go in the other room.
Well, that's fantastic that you didn't spread it to him. It's really showing how careful you were because it's hard.
Thank you. It was a combination of N95s and him on the couch watching Netflix while I went outside. But there were things that were a little bit concerning, I would say, because I was thinking about this conversation. We'd already scheduled it.
Yep.
And I was like, oh, okay, well, we both like wipe our face with the same cloth in the bathroom.
Yep.
Right? Or even wipe our hands or what have you. We handle the same dishes. We sit on the same couch. The spread of monkeypox is kind of where people get a little like, what?
Yeah.
Because we know sex. Okay, I can file that in my brain under, if you have sex with someone, you're at risk of like herpes, syphilis, these other diseases. Monkeypox is now also on the list.
Yeah.
But I don't think about that when I think about just living with someone, And so tell us about how it spreads, and then I'll tell you my further concerns.
Yeah, definitely. Happy to answer those. So like you've kind of touched on, the main way that we're seeing people getting, people getting monkeypox
2022.
right now, I know, it's on the brain, is that prolonged close skin-to-skin contact. And so it's not the person you're passing in the grocery store. It's not like COVID where, someone can spread it within 6 feet through just breathing. It really has to be that really direct contact with someone who's infected.
Yeah.
And then the only other way that we're really seeing that it's not that direct contact is through direct contact with a person's, like you talked about, linens. So it's the towels, clothes, bedding, things like that. There's other kind of objects. So like if someone were to, for instance, use a sex toy that touched the sore, that could then be a way that people might be able to contract it.
That makes sense.
So like the main thing is you want to make sure that those things are getting sanitized before they're exposed to anyone else. If you're not feeling well, if you notice a bump or a rash.
If you notice a bump or a rash.
Yeah, if you notice a bump or a rash, anything like that, then you want to make sure that those things are not being used by other people.
And it's like the bump itself that has, this is my Googling showing.
Yeah.
The bump itself that has the virus, right?
That can spread it, yep.
Yes.
That's why you're really not infectious until you get those bumps.
Yes.
And so for things like, we don't want to sound the alarms for like any surface that's in public you could get it from.
Mm-hmm.
Most people are covering the spots where they're getting monkeypox. So if you're wearing clothing, chances are the majority of the potential transmission sites are not going to be something that the everyday person is going to come in contact. If it's in your hand and you like shake hands with somebody, that could be, but for the most part, that's not going to be the case.
But then those people who are in, I'm going to say high touch or intense touch or deliberate touch professions like massage therapists, they would want to be super careful about their clients, for instance.
Absolutely, both themselves and keeping an eye out for any symptoms on their clients as well.
But that's not where we're seeing it mostly.
No.
It's primarily in like gay men having sex with each other.
We're mostly seeing it in men who have sex with men, and it's self-identified gay and bi men, but it's also something that isn't limited to those communities. There really is no sexual orientation or gender identity that's associated. It's just this current outbreak. We're seeing that more in that community, but it is coming to other people. We know that men who have sex with men are in contact with other people in the world. And so we are seeing it. We do have some cases in Minnesota, for instance, of women that have it.
I have a story about that. So like I told the camera earlier, I went to Montreal for a bachelor party. And so we're in this club with some professionals, let's say. And one of the ladies who's there is having her bachelorette party. And so the professional is very much in contact with this woman. And then a few minutes later, very much in contact with this guy. And I'm like, that's how it spreads. We are one bachelorette party away from this crossing over.
Yeah.
And so when we're talking prevention, cover up your spots if you are personally infected. And then what would, like for me and for those of us who are in the clubs, what do we need to do?
So I would say if you do have those bumps, it's really important that you get tested and you do stay home, if at all possible. I mean, going out for groceries and things like that is fine. But, and you can actually put if you only have one spot in a visible area, you can actually put a Band-Aid on it and that can reduce the risk, but it doesn't fully prevent spread. But for instance, if you needed to, go to the grocery store for basic needs.
Which people often have to do.
Yeah, as we saw with COVID, it was really hard for some folks when they would get infected. But for people who are not infected currently, some things you can do, for instance, like if you want to go out dancing, if you're like walking by somebody and you bump them, it's really not a risk. But like if you're that situation you talked about where there's a lot of intimate contact, or you're at a club and you're dancing for several hours and it's pretty packed and you're kind of rubbing up on everybody.
Yeah. They're playing that new Beyonce album.
Yes.
Everyone's twerking.
Then the best thing that you can do is wear clothes that cover up most of your body, which is hard because it's summer and because when you dance you get really warm.
Sure.
But if that's something that's important to you, then having things like long sleeves or full-length pants can be great ways to, maybe not touching hands with other people could be ways that you can still enjoy yourself and be mostly protected.
So just touch is all we're really worried about. So if someone sneezes next to me, I need to be worried about COVID, not worried about monkeypox.
Correct. Yeah. I mean, it would have to be someone right in your face, sneezing into your open mouth.
And they need to have it like in their mouth probably or
Yes,
something.
in order to do that. And we are seeing some people who are getting infected through respiratory droplets. And so I feel like a lot of people hear that and they go, oh, it's just the next COVID. But that's, again, intimate, long-term contact with someone's respiratory droplets. So saliva exchange with like people kissing or, things like that. Not, I walked next to the person, they sneezed right here, and now I'm going to get monkeypox.
Yes. And now there is also a vaccine. And unlike the COVID vaccine, this one was already produced, it's been around for a super long time.
Yep.
And one way to protect yourself against monkeypox is to get that vaccine if you're eligible.
Right.
Now, I think my brother-in-law, I don't want to put him on blast, sorry, tried to go get the vaccine and he was not quite eligible yet. His activities did not qualify him. Do you happen to know, are you able to speak to the decision making that went behind like who is eligible, who is not eligible?
Yeah, so we took our guidance directly from the CDC. And the CDC was really basing it off of who we were seeing getting infected and who could be most at risk of being in contact with those folks. And so because we have a very limited amount of vaccine right now nationwide, they really had to be very strategic in the highest risk individuals. And for Minnesota, even more so. We don't have as large of an outbreak as other states, like New York and California right now have pretty significant outbreaks. So they're getting a lot of vaccine, and we're getting it based on a more limited number of cases currently. And so in collaboration with the people who are providing vaccine in Minnesota, MDH is really thinking strategically about, based on what we're seeing with this current outbreak, who needs to get this now.
Yes. And I think, I don't know, you've probably seen the memes where it's like, I'm gay, get out of my way. The community has been kind of incensed, I would say, incensed by that response where like, but I don't want to adjust my own personal behavior. I just want to get the shot and keep living life the way I've been living it. But, much like with COVID-19, we've got a virus that we have to get under control. And we actually have the opportunity through behaviors to like get things under control before it spreads into the broader population. And so if you're able to get vaccinated, if you fall into that high risk category, the last time I checked the website, it said your physician would be calling you.
For the most
still the
part,
case?
so there's a select number of clinics right now that have access to the vaccine and are vaccinating folks currently. And for the most part, what they're doing is basing it off of the patients they already have established care with, who they deem to be a part of that high risk category. So we do see challenges there because that's people who are connected to healthcare, and there are a lot of conversations happening right now about how do we make sure that we are putting equity in the forefront for those folks who may not be a part of that short list right now, but are definitely in that high risk category.
Now, when it comes to equity, and just that we only have a couple of minutes left in this segment, so you may not have the answers for this one. I do chair the Public Health Advisory Committee for the City of Minneapolis. And one of my committee members is primarily focused on monkeypox in our houseless population. And I don't understand why. When COVID came, I was like, oh, this is going to tear through that population. We got to do what we can. And it just slipped my mind when this monkeypox outbreak came, knowing good and well that I had had Avenues for Youth on here talking about homeless youth just a couple of episodes ago and how vulnerable those populations are. Do you happen to know if the state is taking extra steps for people who don't have homes, who are diagnosed with monkeypox or anything like that?
I do know, so I'm not directly involved in the response part, the part of the response that's working with the unhoused communities. But I do know that there's a lot of intentional work that's happening around that. There's a lot of outreach, a lot of collaboration with shelters and other service providers for folks who are experiencing homelessness. But unfortunately, I don't have the details on what that looks like.
Yeah, you can't do everything.
Yeah.
You do a lot. You can't do everything. It's just, as I was sitting there with COVID, again, with all of those positive tests, I was really thinking about how lucky I am to be in a position where I could just sit in an extra bedroom
Absolutely.
and wait it out for 10 days, and
Yep.
how difficult it would be for someone if they didn't work from home. They had to go, and they had to either wear a mask or wear the sleeves or the Band-Aids. But then, like, having no home at all, like
Yeah.
and maybe even no access to those resources, it's tough.
Right. Absolutely.
Well, let's take a quick coffee break. We'll come back with more from Mattie Laidlaw from MDH, and we'll talk through navigating monkeypox and COVID-19. Welcome back to Bottomless Coffee with Jerome. We are talking with Mattie Laidlaw about navigating this moment of monkeypox and COVID-19. So there are obviously a lot of differences between the COVID-19 vaccine and the monkeypox vaccine. They're two totally different viruses, and their vaccines work differently and they do different things. Can you tell us a bit about not the COVID-19 vaccine, but monkeypox vaccine?
Yeah, so it's been around for a while. It was because monkeypox is in the same overall family as smallpox. It's actually the vaccine for smallpox. So that's been around for a really long time, and we're seeing that it is really effective at preventing people from getting monkeypox. It's not 100% guaranteed, just like any vaccine. But if people get it when they're at high risk and not exposed, or shortly after they have an exposure, if they immediately go in and get vaccinated, they're seeing that it is preventing people from progressing on to a full infection.
Okay. So there's a little bit there. I believe, again, from Instagram and TikTok, this is a 2-dose vaccine.
Correct.
Which is similar to, I think, the 3 recommended COVID-19 vaccines.
You can still get the Johnson & Johnson, but the
can.
higher tier ones, the first line of defense, if you can qualify for them.
Okay, because I got the Johnson & Johnson,
Yeah.
But it was what I could get at the time, and so it was really great. And I would
It's better
probably
than nothing.
I would probably do the same thing if there were multiple options of the monkeypox vaccine and I were at risk. I'd say, oh, okay, well, let me get what I can. But how many options for the how many options for the monkeypox vaccine are there?
Currently, it's the Jynneos vaccine.
Okay, 1.
Yes.
Okay, so you know where you're going to get if you're going in for the monkeypox vaccine. 2 shots. How protected would you say that a person is after that first one? Like they leave the clinic and they're back up to their old ways, or?
I mean, it's not the full protection that you need. I don't know if there's data on the percentage of protection that you would have. It's better than nothing. But we definitely recommend that people wait at least 2 weeks after the second dose before they feel like they're have all the protection that the vaccine can give you.
So it's dose 1, 2 weeks, dose 2, another 2 weeks.
Yes.
So hot vax summer is really done because of monkeypox.
Yeah.
Okay, you're really moving well into the fall, which is, just where we are right now.
Yeah.
What are the side effects to the monkeypox vaccine? And I had to take a moment to make sure that I said monkeypox instead of COVID-19.
I don't actually know off the top of my head. I'm sorry.
No, you were good, because I did a podcast, and I think one thing I've been hearing about is like a bump.
Oh, yep. No, that is accurate. So this is actually something I should have specified. So while we use the Jynneos vaccine, there are now 2 ways that people are getting it. So one is called the subcutaneous route, which is like a normal shot, like injection, that goes into the fatty tissue of your upper arm. And then the other is an intradermal. And so that's the newer one that just got authorized by the Biden administration. And what that one does is it actually puts the vaccine between layers of skin. And so It's something where it can use less vaccine product, which is great because we don't have a lot right now as a country. But it provides the same level of protection as the shot that goes fully into the arm. And for the one that is that intradermal through the layers of skin, some people do get a bump. And unfortunately, because of the way that it's supposed to be administered, it goes into the forearm. So some people are like, oh, well, then it'll be visible. That's where I would really say, rather than trying to like push it down or anything like that, just put a Band-Aid over it and then no one will know. And it'll resolve itself in a couple of days.
Even be a cute Band-Aid.
Yeah.
Flintstones.
I know.
Why not?
I have Band-Aids from 2 years ago, Pride, and they're Pride flags.
Oh, see, I love that. Okay, so we're, again, with the differences between the vaccines.
Yep.
The COVID vaccine, pretty new. I think, was the first variant called Alpha, or did we just call it COVID Alpha, or were we just calling it COVID
I don't know
way
if
back
we
in the day?
labeled it.
Yeah, well, whatever, COVID 1.
Yeah.
I think the vaccines were to help slow the spread, prevent infection. They don't really do that as well anymore, but they're still really effective at preventing serious illness.
Yes.
Okay. Monkeypox vaccine. Really good at preventing infection, or is it a preventing serious illness situation?
It's really effective at preventing infection, and if you've been exposed, to prevent it from progressing on to the symptoms that you would see.
Okay, now that is just definitely distinct from COVID, but it's kind of like rabies.
Yeah.
As I'm sitting here, because I think like you get bitten by a weird squirrel or something, and they give you all like a bunch of shots to make sure that the symptoms don't develop. Similar with monkeypox.
Yes.
Very useful. And then if you've been exposed, I think you're put on that high priority list, so you can go and get the vaccine.
You can get it right away if you've been exposed.
Now, testing.
Yes.
How does the test work? I've never even seen a monkeypox test. I don't know.
So it's something that you can get at you should be able to get at any healthcare provider, actually.
Oh, that's nice.
Yeah, and the only way that they can do it is to swab the bumps. So if you are feeling ill, but you don't have any rash right now, you really can't get tested. But if you do see the bumps, you go in, and what they do is they just take a swab and they just rub it on the bumps, essentially. And so they try to get, if there's any fluid, they'll try to get that. If there's any like skin flakes or scabbing, they'll try to get that. And then they put them into a container and get sent to a lab and get tested.
Oh, do you happen to know, is it like, 3 weeks to get the results back?
No, it's a lot faster than that. I think it's a couple of days.
That's nice. And then during that time, they're probably like, hey, wear long sleeves and
stay home
cover
if
up.
you can.
Yeah.
And make sure you're limiting contact with other people.
Very cool. That's it. It sounds like the system is kind of working.
It's getting there.
Yeah.
It's definitely getting there. Yeah, I feel like we learned a lot from our mistakes in the early parts of the COVID pandemic, and so.
Well, it was your first pandemic.
It was. There's been nothing like it.
Yeah, and no one wants it to do it again. So we're like, okay, let's get ahead of this. And I think, so I put a call out to the internet. It's like, hey, we're going to talk monkeypox. Do you have any questions? And in my mind, 3 good ones came up. There were a lot that were like, how are we having to do this again? Shouldn't the spirit was kind of like, shouldn't the government just have like professionals ready at all times for any disease? And if any population is ever showing something, then, teams of hazmat suits should parachute from the sky and start jabbing
like
arms.
Monsters Inc., where they're just like jumping in through the windows.
I think a lot of people forget that it's, actual human beings who are just as caught by surprise as you are when something like this happens.
Right.
And then you have to really become an expert kind of quickly while preparing a response, like a medical response. Yeah. You're like, I don't know how many vaccines we have. I don't know where they are. I don't know. A new way of sticking arms, like who's trained for that?
Yeah, and it is something that one of the reasons there's just a little bit of a delay that we're seeing is because there's a need to train the vaccinators. So they know, they're very familiar with the subcutaneous just injection. This intradermal through the skin layers is very similar to a TB test. So like a lot of people have that background, but there's still a need to do some training there. And so there's always these new hurdles with a new epidemic. Like hopefully like we don't continue to have them. But for instance, with the monkeypox outbreak, like we mobilized quickly, honestly. I'm still on the COVID response, but I was tapped right away for this. So.
I think it's also helping and hurting, I guess, the LGBTQ plus community, we are tightly knit. And so almost overnight accounts were springing up that were like, this is what we know today. This information may not be true tomorrow, but you know, like some of you are living with 7 or 8 people in the house.
Yes. Yes.
Separate your laundry, you know. Other questions and things I learned. Apparently, if you scratch here an infectious bump and then scratch your leg, you'll end up with the bump on your leg.
You can transmit it to other parts of your body.
Yeah, that was a surprise.
Yeah.
And then the follow-up question that the person had was, how long after like the scab falls off and it's healed over, might you still be infectious, or is it just go away like with the scab, or what's the deal?
Yeah, so the way that you can transmit it is through when you have those scabs. And so if you have the bumps and then the bumps, scab over and then the scab flakes off, then you are not considered to be infectious anymore.
Fantastic.
Yeah. So it's unlike COVID, there's a really clear indicator of I am no longer infectious. Whereas with COVID, we took so long to try to figure out how long that people can give it to other people. Do you need to test negative beforehand? All that. It's a very clear, like, there's the symptom is gone, it's healed over, you're good to go.
Fabulous. I love that. Okay, the next question, why isn't the vaccine available to everyone that thinks they're at risk? Which we touched on a little bit due to supply. But is there a mechanism for people who maybe don't fit the standard criteria for high risk to get a dose?
Unfortunately, not right now. So just because we have so limited resources right now, it's just we're having to be very, very strategic and making a lot of really tough calls.
Yeah.
And so our providers are really the experts, and we're kind of deferring to them on if there's certain patients that they have that they want to vaccinate first. And so it just like is such deja vu from the beginning of the COVID response vaccination campaign, because like I was a part of that too, where it was just there's so many people who need this, and we want to be able to give it to people. It's just we're really constrained by resources right now.
And in that situation, as we know, you take precautions for yourself. You be your own advocate for yourself as well as you can be.
Yeah, so prevention is key. Even for people who are vaccinated, we're still suggesting that they continue to be careful. And so some of the things that you can do right now is, if you can, limit the number of partners that you have. So the partners that you're having intimate contact with. Yeah. Particularly if you can limit partners or doing sex work yourself. We're seeing that more in that community for being at higher risk. If you can, let me see, what are the other ones we have? So limiting partners, talking to your partners. So a lot of these are things that we learned with the harm reduction strategies of the HIV epidemic, which was really having, and other STIs, is really having conversations with potential partners. This is not an STI. We are not seeing it being transmitted from our current data through fluids, but we're still seeing that as a common behavior that's associated with this current outbreak. And so really just like having those honest conversations with partners, if you have established partners, new partners, or potential partners, of like, hey, let's look at our bodies and see and make sure we don't have bumps before we get into contact with each other.
Yeah, I totally agree. I also think the definition of intimate contact can be a little bit different for our community.
Yes.
Once again, hearkening back to that trip to Montreal, 2 friends were cuddling. They were like just in the bed, chit-chatting, cuddling.
Yep.
And I was like, you guys.
Yeah.
I don't want to ruin a beautiful moment, but.
Yeah, just check yourself out. Is everything okay? Yeah.
Yeah.
Because really it is getting sexualized by the media in a lot of ways.
Of course.
But it's not like just penetrative sex. So we're seeing, it can be transmitted through anal sex, vaginal sex, oral sex. But then like you're saying, it can be different kinds of intimacy, but it's just that close skin to skin contact. That's really the thing you need to look out for. And that can be, with non-sexual partners.
Yeah. Because I'm imagining, kids are going back to school, the wrestling team, they already transfer like cauliflower ear or something,
Yeah.
like things already transfer on those wrestling mats. So I would think, okay, if I know that my child is going to be in a situation where bacteria is already like transferring, just be extra careful.
Yep.
Yeah.
Yep. And just be aware of your body and the bodies of people that are
Absolutely.
you're getting into close contact with.
Absolutely.
And then, like we had talked about the bedding and the linens, just really avoiding, if you have monkeypox, for sure not letting other people do your laundry unless they're wearing a mask and gloves.
This is coming to mind. Don't share clothes.
Yeah.
I used to share clothes with people all the time.
Yeah.
Put the sisterhood of the traveling pants to rest for a little while.
Just for a little while, just until those scabs are over and everybody knows that they don't have it. Yeah.
Yes. Okay, the third question was monkeypox has been declared a national emergency. What does that even mean? This just happened. So
Yeah.
do you happen to know what that even means?
I mean, for the folks that are listening, the most important thing to know is that just gives the president the ability to put a lot of money towards the response.
Yes.
So it can mobilize resources. So things like my pandemic group comes together and can dedicate our time to this. That's essentially, it gives the green light, whereas normally you would need to go through a whole process with the Congress. It's saying, this is important, we need to do this now, and we're gonna put some money toward it.
Wonderful. Well, we got to take another quick coffee break, but then we'll be right back with more from Mattie Laidlaw from MDH. Yay. We have learned a lot about navigating monkeypox and COVID-19 today. Our guest, Mattie Laidlaw from MDH, has really dropped some serious knowledge, and we're all better off for it. So, as we close, Mattie, what are some of the best places to get up-to-the-minute information on monkeypox? Because kind of the nature of this production is it's going to take time to get it out there, and people are going to be like, no, I need to know as of 5 minutes ago. What's the latest?
Yeah, so definitely our Minnesota Department of Health monkeypox website is continually being updated. In fact, we have daily counts for how many cases in Minnesota put up at 11 a.m. every day.
Nice.
Monday through Friday, I should say. But that's a really great place to get information. So you can just go onto Google and say Minnesota Department of Health monkeypox, and it'll pull up that website for you. And there's also the CDC has a really good website right now for monkeypox. They have some really good videos that are very informative and helpful. Our social media for the Minnesota Department of Health has a lot of those updates coming up and links to the resources. And then if you're somebody who really wants to stay in the loop about, in particular, what MDH is doing right now, and then the latest information directly from scientists, we have every other week something called our Monkeypox Community Partner Call. And so if you go on to the Monkeypox website for Minnesota Department of Health, you can actually subscribe to our mailing list, and then you'll get emails with invites to those calls, as well as whenever we have any new resources, those will be on that email. And when we get a lot of frequently asked questions, we're now starting to have it where we will also have a little explanation like, hey, this is a question we're hearing a lot about, and this is what we know about that.
That's nice.
Yeah, so those are, I think, what I would recommend for the most up-to-date information.
I would say the website is the resource I probably use the most. And one of the phrases I recall texting to a friend is, better prepared than scared, because she was like, oh, there's monkeypox going around, so I can't order clothes online and try them on. And I was like, I don't think.
Yeah. There's been a lot of alarmist stuff on some social media because people want to protect themselves, and it's scary to have another thing. So.
Yeah. But I would say if you are outside of the LGBTQ community right now, I would assess your risk at like medium level rather than pretty high. And generally, if you're living in Detroit Lakes, Minnesota, and you're ordering something from like China to try on Amazon or something, relax.
Yeah, right. And these viruses don't last forever on those on fabric anyways. So.
And then you could wash it.
Absolutely.
Yeah. Okay. And then I'm really loving this last question I try to ask people, because occasionally it spirals off into a whole other conversation. So we'll see. Is there like a final message that you want to make sure that our audience takes home with them today?
Yeah. So I know, for instance, when I first heard about monkeypox, I was like, oh my gosh, the next COVID-19. And I was really scared. But that's really not what this is. It's the majority of people are not at risk of getting monkeypox. And if we take those really simple ways of preventing the spread, we can really get a handle on this. And you can do a good job of protecting yourself. So while having a vaccine is something that so many people want and need, really those prevention messages of limiting the number of sexual partners you're having right now, talking to those partners that you have about monkeypox, just keeping an eye out on your body and the bodies you're in contact with. And then really if there's somebody who has monkeypox, staying home and not letting other people take care of your laundry.
And if do your own laundry, everybody.
Do your own laundry. Or at the very least, have them set aside for when you're feeling better.
Yes. And if you have been exposed, call your doctor ASAP, because maybe you can get a dose of the vaccine that will prevent the symptoms.
Yeah, if you are someone who was exposed, you are a high priority for getting the vaccine.
Fantastic. Thank you so much, Mattie, for taking the time to come drop some knowledge on us today. I feel like we've learned a lot.
Thank you. Well, I'm really glad that you reached out and to be here.
Hey. Well, that is it for this episode of Bottomless Coffee, everybody. I am Jerome Evans. Find out more about us and stream all our episodes on bottomlesscoffeeshow.com. See you next time.